In this video, we are going to deal with mental status examination. In psychiatric assessment, there are three methods. The last method is MSc and first method is psychiatric interview and case history and next MSc. MSc means mental status examination. In mental status examination also, there are so many subpoints. Then in mental status examination, the first and foremost important point is general appearance of a person. General appearance means the sitting positions, the dressing style, eye contact, their attitude towards the social worker or psychiatric social worker, etc. That is well kept and tidy, overly made up, unkempt and untidy, sickly, perplexed and bewildered. Then second one is touch with surroundings. Is the patient is touch with surroundings means if the patient is aware about their surroundings, residing in a psychiatric hospital or there are psychiatric patients are going on there like that. Is this present, partial or absent? Then next one is eye contact with the examiner. Is there any eye contact with the examiner is present or partial or absent? That is we are examining. Then dress. If the dress is shabby, inappropriate or appropriate, we want to mention. Then comment about that. Then about the rapport. It is easily established or established with difficulty or not possible or attitude toward examiner. It is that means for building rapport, if the patient is very comfortable or it is very easy to establish a rapport or it is very difficult or the attitude towards the examiner. The attitude towards examiner means it is cooperative, it is defensive, or he or she is attentive or frank or attention seeking person or a suspicious persons, like that we want to mention. And we want to mention the comments about that. Then next one is motor behavior, like appropriate behavior or inappropriate, like hyperactivity, destructive, silly smiling, aimless, self-injuries, aggressive, mannerisms, waxy inflexibility, gestures, hallucinatory, stereotype, or restless person, or odd postures, like that. Then voice and speech. If the voice and speech is intensity, the intensity of the voice, it is audible or excessively loud or abnormally. Then reaction time. Reaction time is very delayed or normal. And the speed they talk or interact with them, that is normal or very slow. Then relevance. That is, it is relevant or irrelevant, or there will be a flight of ideas is going on there that we want to mention. Then coherence. Is there is any coherent or incoherent, that also we want to mention. Then goal direction. Is there a goal directed speech? Is it circumstantial or tangential? Then productive. Is there any productive as normal or overabundant or scant? If the productivity of the speech is scant one or normal or that. Then manner. Or he or she is relaxed manner or tensed up or disinterested in a interaction section or excessively formal or inappropriately familiar, that we want to mention and comment about that. Then deviation. Rhyming and punning, talking past the point, clank associations, stereotyping, preservation, like that. The deviation in speech and volume. Then affect. Affect means in affect there will be subjective and objective. That means we can say that in mood we can say our mood is very happy. In subjective happy and objective happy. But affect means if we ask the patient, are you happy? Then they said happy. But the affect means that they shown in their face, that the expression. If they said that they are happy, but their expression is very unhappy mood, then that is affect. Affect means what they show, what they express in their face, that is objective. So affect means what they present in their face. Then stream of thought. It is normal stream or retarded or accelerated. It is a pressure of speech. That means in thought there is a stream of thought, means so many pressure of speech is there. The thought processing is very streaming. Then possession of thought. Is there any thought blocking problem? Thought broadcasting, thought withdrawal, thought insertions, thought echo, thought alienation. If there is any thought blocking like that, it will be, if they say something about one topic, sometimes it will be cut and going to the next topic like that. Is there any withdrawal in the thought? Like that we want to mention. Is the thought process is absent or present? We want to mention. Then form of thought. We want to mention is it present or absent. First one is loosening of association. Is there any association is loosening? Like that direction of thought is not going in a proper manner. Then next one is illogical thinking, neologism, word salad, over inclusion, condensation, incomprehensible speech due to psychopathology. That means, is there any thought process problems going in patients? There will be different types of form of thoughts are going on. They provide different words regarding one topic. Sometimes we couldn't understand because they are talk about difficult words. They will provide difficult words that we can't understand. So is it a word salad, or is it there's no association between the sentences or loosening of association? Then we want to mention it. Then content of thought. Content of thought. If the content of thought is absent or present. Obsession, compulsions, phobias, religious preoccupation, ideas of hopelessness, ideas of worthlessness, suicidal idea, preoccupation with precipitating factors, hypochondriacal ideas, depersonalization, derealization, antisocial urges, homicidal ideas, excess daydreaming, preoccupation of thought, sex preoccupation, ideas of reference, philosophical ideas and delusions. If anything is absent, if anything is present, we want to mention all of this. Then persecutory, grandiose, reference, control. That is different types of delusions. Delusion of love, delusion of reference, delusion of persecutory, delusion of grandiose. If anything is present, we want to mention it. Then hallucination. Is there any auditory hallucination? Is there any visual hallucination, olfactory hallucination, gustatory hallucination, tactile, kinesthetic? Then we want to mention which hallucination is occur in most of the time. Then other perceptual disturbances. Any illusions, pseudo hallucinations are present or not, and we want to mention the comments regarding that disorders. And there is any phenomenon not described elsewhere. That is anything elsewhere. Any other comments we want to mention, that also we want to write down in that MSc. And if there are any higher mental functions we want to know about that, then we want to mention about the attention and concentration of the patient. For that, we want to first of all easily aroused and sustain, easy to arouse but not sustain, difficult to arouse and sustain, difficulty to arouse but sustain. That is, we want to know their attention and concentration. For we can give some, when we are talking about that, please repeat what we are said, please repeat that, or when they said about something, can you please explain about that? So if they are listening or attending what we are saying, we can or they are concentrating about what we are saying, we can check whether they are attending attended or concentrated person. Then we look on to their memory. If they have recent memory power, if they have a remote memory, if they have recent past memories, and immediate memory is going on there. If they can recall their memory, so we can test their memory. Then orientation. Orientation means there are three factors in while testing the orientation. One is time, place, and person. Time means approximately what time of the day is it, or what place is this, or inquiring about the identity of the patient's relatives or family members, etc. By this we can know the orientation of the person. Next, intelligence of the patient. Intelligence means this includes the area of general information, comprehension, arithmetic, and vocabulary. For the intelligence, we can provide general information and ask name of the Prime Minister, or comprehension means what will you do when you feel cold, like that, any comprehensive questions, or arithmetic questions like any mathematics. Then any vocabulary questions like that. Next, we move on to the intelligence as answered. Is the how intelligence is average or above average or subnormal. Then we can move on to the judgment. Test given and responses is answered in the following areas. Is the personal, social, and test. Personal judgment is answered by inquiries about the patient's future plans. Social judgment is answered by inquiring into the patient's future plans with regard to occupation or other responsibilities. Test judgment means the following two problems are presented to the patient in a manner in which he can be comprehended. That one is, for example, first one is fire problem. If the house in which you are catches fire, what is the first thing you will do? We can ask for the judgment. Then what will they do? Then we can one more example is letter problem. If when you are walking on the roadside, you see a stamped and sealed envelope with an address on it which someone had dropped, what will you do? Correct answer: post it in a letter box or give it to the postman. What is the answer of the patient? Please check their check what they said and test their judgment. That is judgment of the patient. We can judge the person by asking questions. If they are providing normal answers like a normal person, we can judge if he is normal, or if there is any variations in their thinking process, then we can say that there is variations, then provide comments like that. The next one is insight. Complete denial of illness. Slight awareness of being sick but denying at the same time. Awareness of being sick but blaming it on external factors. Awareness that illness is due to something unknown in the patient. Intellectual insight, true emotional insight. Insight regarding the patient's illness. If the patient is if the patients had the insight regarding their problem or illness, if the patient is insight about their problem and he is and he is blaming the external factors. Is the what was the condition regarding the illness and the patients about the insight. Then provide summary of the patient, then professional diagnosis regarding ICD code or ICD-11 or according to DSM 4 or 5. Then mention the problem areas